Welcome to Quest for Wellbeing. In this video, we delve into strokes and their impact on health. Join us as we embark on a journey to uncover some insightful aspects of this medical emergency. Strokes are medical emergencies that occur when blood flow to the brain is interrupted or reduced, leading to the sudden impairment of brain function. There are different types of strokes, each with its own underlying causes and warning signs. Recognizing these warning signs is crucial for prompt medical intervention, as timely treatment can minimize brain damage and improve outcomes. In this video, we will explore the various types of strokes and the warning signs that signal the onset of a stroke, empowering individuals to recognize and respond effectively to this critical medical condition. Let us turn our attention to the different types of strokes. Number 1. Transient ischemic attack, or TIA. A transient ischemic attack, known as TIA, refers to a brief interruption of blood circulation to the brain. Typically, the clot causing it dissolves spontaneously or becomes dislodged, resulting in symptoms lasting for usually under 5 minutes. TIAs can occur in anyone, but the likelihood rises as one ages. The risk of experiencing a stroke escalates with each passing decade after reaching 55. If you've had a stroke before, it's crucial to be vigilant for TIA symptoms, as they might indicate a subsequent stroke. Common warning signs include sudden onset of weakness, numbness, or paralysis on one side of your body, slurred speech or difficulty understanding others, blindness in one or both eyes, dizziness, and severe headache with no apparent cause. Number 2. Cryptogenic stroke, or stroke of unknown cause. The primary cause of strokes is typically a blood clot obstructing blood flow to the brain. However, there are cases where the exact cause remains unidentified. These strokes, known as cryptogenic, occur when the underlying reason cannot be pinpointed. Roughly 25% of individuals who have experienced a stroke are at risk of experiencing another one. Therefore, it's crucial for healthcare professionals to accurately diagnose the condition and identify any potential risk factors in order to administer specific treatments aimed at preventing future strokes. Collaborating closely with your healthcare team is essential in this process. Some studies suggest that the incidence of cryptogenic stroke is higher in African Americans, 2 times more likely, and Hispanics, 46% more likely. Here are some possible hidden causes of stroke. Irregular heartbeat, also known as atrial fibrillation. AFib patients are at a 5 times greater risk for stroke. Heart structure problems such as patent foramen oval. Hardening of the arteries, known as large artery atherosclerosis. And blood clotting disorder, or thrombophilia. Even if the reason behind your stroke remains unidentified, it's crucial to adhere to your doctor's recommendations and consistently take your prescribed medications. And if you're provided with a heart monitoring device, make sure to adhere to the prescribed routines. When the underlying reason for a stroke remains unidentified following standard assessment, it becomes crucial to conduct further investigation to obtain a conclusive diagnosis. The involvement of neurologists, cardiologists, electrophysiologists, and other essential team members in a collaborative effort can potentially uncover the necessary information to administer specific treatments aimed at preventing future strokes. Number 3. Hemorrhagic stroke, also known as bleeds. Hemorrhagic stroke occurs when a weakened blood vessel ruptures. The 2 types of weakened blood vessels that usually cause hemorrhagic stroke are aneurysms and arteriovenous malformations, or AVMs. The most common cause of hemorrhagic stroke is uncontrolled high blood pressure. Approximately 13% of stroke instances are attributed to hemorrhagic strokes, which happen when a compromised blood vessel bursts, leading to bleeding into the nearby brain area. This accumulation of blood exerts pressure on the surrounding brain tissue. The two types of hemorrhagic strokes are intracerebral hemorrhage, which occurs within the brain, or subarachnoid hemorrhage, which happens between the inner and outer layers of the tissue covering the brain. Number 4, ischemic stroke, also known as clots. An ischemic stroke is a medical emergency caused by a blockage in a blood vessel that supplies blood to a region of the brain. Symptoms may include facial drooping, limb weakness on one side, and slurring words. Ischemic stroke is also called brain ischemia and cerebral ischemia. Ischemia is the medical term for lack of blood supply. The blockage is often caused by blood clots or fatty deposits inside the blood vessel. According to the American Stroke Association, ischemic is the most common type of stroke, accounting for about 87% of all stroke cases. Let's delve into the warning signs of stroke. FAST. What does this acronym stand for? The letters F, A, S and T are key to identifying a stroke. F stands for face drooping. Is one side of the face drooping or numb? Ask the person to smile. Is the smile uneven? A stands for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S stands for speech difficulty. Is the speech slurred? And T stands for time to call 911. Other stroke symptoms include sudden numbness or weakness of the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Trouble seeing in one or both eyes. Trouble walking, dizziness, loss of balance or coordination, and a severe headache with no known cause. Signs and symptoms of a warning stroke, also known as a mini-stroke. A transient ischemic attack, or TIA, is a warning stroke, but is commonly referred to by the public as a mini-stroke. A transient ischemic attack is a critical medical situation presenting symptoms similar to those of ischemic and hemorrhagic strokes. However, because TIAs typically endure for just a few minutes to a maximum of 24 hours, they are frequently overlooked and not given due attention. Transient ischemic attacks, which precede approximately 15% of strokes, serve as warning strokes, indicating a heightened risk for subsequent TIAs, full-fledged strokes, or related cardiovascular issues. The majority of these subsequent health complications manifest within a short time frame following the TIA, underscoring the critical importance of early interventions aimed at mitigating risk. If you or anyone with you shows signs of a stroke or any other related symptoms, seek immediate medical attention. It's crucial to note the time when the initial symptoms occurred. Even if the symptoms go away, call 911. Symptoms of silent stroke. Undetected strokes, known as silent strokes, happen when a blockage in a brain blood vessel results in cell death without any apparent warning signs or symptoms. Approximately 25% of individuals aged 80 and above exhibit a form of tissue damage in the brain referred to as a silent infarct. This occurrence becomes more prevalent as age advances, particularly among smokers or those with a background of vascular diseases, which impact blood vessels. According to experts, there are approximately 10 silent strokes for everyone that exhibits detectable symptoms. Despite their silent nature, these infarcts have been associated with subtle impairments in both movement and cognitive functions. Additionally, they are connected to increased risks of future stroke and dementia. How are symptoms of posterior circulation strokes different? Strokes affecting the posterior circulation target the rear region of the brain. These incidents occur when a blood vessel in this area becomes obstructed, resulting in the demise of brain cells, known as an infarction, within the affected blood vessel's territory. This particular stroke can also result from a ruptured blood vessel located in the posterior region of the brain. When such a stroke occurs, it presents a range of symptoms distinct from those observed in strokes affecting the blood flow to the frontal part of the brain, known as anterior circulation strokes. Symptoms include vertigo, the sensation like the room is spinning, imbalance or one-sided arm or leg weakness, slurred speech or difficulty in speech known as dysarthria, double vision or other vision problems, and a headache, nausea and/or vomiting. Seeking prompt medical assistance is crucial if you experience a stroke. Swift intervention can help mitigate potential long-lasting consequences and could potentially avert fatalities associated with strokes. Thanks to recent advances, stroke treatments and survival rates have improved greatly over the last decade. But in order to seek treatment, you must recognize the signs and symptoms of a stroke and know what to do. Remember, if you're experiencing face drooping, arm difficulty, or speech slurring, it's time to call 911. Stroke can occur regardless of age or time, and it's imperative for everyone to recognize its warning signs. Approximately 1.9 million brain cells perish per minute if a stroke is not promptly addressed. It ranks as the 5th leading cause of death and a prominent source of disability in the United States. Swift intervention results in improved chances of survival and reduced disability rates. Contacting 911 enables first responders to administer treatment to individuals exhibiting stroke symptoms even before reaching the hospital. Stroke is an emergency. Every minute counts. Call 911 immediately. Note the time when any of the symptoms first appear. In conclusion, understanding the various types of strokes and recognizing their warning signs is crucial for early detection and effective treatment. Ischemic strokes caused by blood clots and hemorrhagic strokes resulting from bleeding in the brain present distinct symptoms that demand immediate attention. Familiarizing oneself with these warning signs, such as sudden numbness, confusion, difficulty speaking or walking, and severe headaches, can potentially save lives by prompting timely medical intervention. By raising awareness about strokes and promoting education on their warning signs, we can empower individuals to take proactive measures to reduce their risk factors and seek prompt medical assistance, ultimately improving outcomes and reducing the devastating impact of strokes on individuals and communities alike. Did you find this quest insightful? Well, if the answer is yes, please let us know by commenting in the comment section below. And please remember to like, share, and subscribe to our channel for more insightful videos. Cheers to an enriched life. Thank you for watching.